Dr. Michael Greger, thank you so much for joining us today on Healing Tomorrow. I really appreciate you making the time to be with us.
Happy to be here. Anything to do for Dr. Michael Klaper.
Thank you. So in our series of Healing Tomorrow, we are looking for how healing looks like in the near future, as well as what we can do to heal tomorrow, because there's certainly tomorrow's in need of healing, among other things as well. So just a few questions. I'd like to know from your viewpoint up in the nutritional crow's nest there, as you scan the horizon there, what do you see over the next 3 to 5 years? Do you see any earth-shaking, science-shaking advances in either our nutritional understanding of food, our new products, new ways of teaching? How does the nutritional frontier look like in the near future to you, the next 3 to 5 years? Anything revolutionary, or just eat plants and take your B12 and get on with it?
You know, I think really the advances in this field were done decades ago, right? I mean, it's like the number of people we could say, now sure, look, we always hunger for more knowledge and we'd love to tweak things, but with the knowledge we have right now, right, we could practically abolish the number one killer, coronary heart disease, reverse type 2 diabetes, reverse high blood pressure. These are massive killers, right? Millions of lives at stake. And it's like, you could argue not another penny should be spent on medical research until everybody's, okay, once we use the knowledge that we already have, okay, so no one else is dying, from these, okay, then all right, let's start figuring out some of the more exotic diseases, rarer diseases. But, for lifestyle diseases, we should treat the underlying cause with, which is, the lifestyle that got them into this in the first place. Well, if they keep down that road, then they're not going to get any better. And so, certainly things recently have changed the landscape, right? These GLP-1 agonists, the like Ozempic, have shifted things, I think, a bit.
In what way?
Well, it's affecting the stocks of fast food restaurants. I mean, that's the kind of, world-shaking effect that these drugs have had. I mean, these drugs are really unprecedented.
People eating more fast food or less?
No, they're eating less fast food, and so they're afraid that the McDonald's stocks are going to plummet because all of a sudden people aren't going to be eating as much junk anymore.
Wow.
And so, this is like so it's $1 trillion. This one drug is $1 trillion industry now, this one class of drugs. And so, it's really, money talks. And so, that's certainly been a big, but, you just don't expect much in terms of kind of lifestyle medications, because it really comes down to lifestyle. So we have the knowledge. Right? We have the bulk of knowledge. We have enough knowledge to save millions of lives. So then really is, how do we get that knowledge and put it into practice? And I think some of the most interesting, innovative, exciting things happening in that sphere are these kind of default plant-based programs, where, for example, in all 9 public health hospitals in New York City, the largest city in the country, all lunches and suppers are plant-based by default. And if the patient says, no, I don't want that, then they're offered a second plant-based default. Only if they ask a third time do they actually get, whatever kind of crap they want. And most are sticking with the default, are enjoying it, saving money, saving the system money. And what a concept. Healthy food in the hospital. Like, what? It's just crazy, right? And so, hospitals were one of the first places to get rid of smoking, to get rid of smoking vending machines. Like, in some ways, the medical field really led that before other, kind of indoor smoking bans were taking place. And so, similarly, medicine could take the lead. And so that it's just kind of win-win-win. Everybody wins. So the hospital can be like, we're doing this because we care about patients. Our bottom line. Fine, I don't care why they do it. But it's just a win-win-win all over the place. Happier patients, healthier patients. And so that's really exciting. So I'd love to see that replicated, right? If they can do it in New York, right? You think they could do it anywhere. So if anyone's involved in the hospital system, talk to the dining folks. Why cannot we have healthier food, not only for the patients, but for the staff. Oh my God. It's just so much, it seems like such kind of low-hanging fruit. And we're not taking away choices from anybody, but just by taking away the candy bars at the checkout line and putting some apples and, it doesn't take much to kind of choice architecture our way into people making healthier choices.
Well, that leads nicely into my second question. If the current Secretary of Health and Human Services wakes up one morning and says, America is still getting fat and sick, I'm not succeeding, I quit. And they say, Dr. Greger, would you please step in? And you find yourself head of HHS. And you had unlimited amount of money.
Now we're talking.
What needs to change? What do you see are the biggest obstacles that need to be cleared away? How do we get this thing actually moving?
Oh, well, I mean, right. If we could actually affect things on that kind of top-down level, then what we'd like to see are, bans on advertising. Right? Again, so I mean, like the real simple, basic stuff that has been shown to be helpful otherwise. So, for example, the, what do they call it? Transport for London, which is like all the advertising for all the buses, trains, everything is run by one agency. And they decided to get rid of, advertising junk and fast food and soda, blah, blah, blah. And they were able to, mathematically model how many tens of thousands of fewer cases of diabetes and obesity, etc., just by not putting donuts in everyone's face 24/7. And so that's the kind of thing where we're not mucking with civil liberties. We're just not, just surrounding people with ads for fast food and junk food and candy 24/7, this panopticon of junk at all times.
Yeah. Let me just add for the freedom of speech folks out there that there is precedent for this. When we were kids growing up, you could smoke on television, you could drink alcohol, that was banned. So you can't advertise now, certainly to children, but no cigarette advertising really on TV. So there are commercial bans that have been successful, and people have accepted that in general. So let's enlarge it to the real threat to most folks there. So fair enough, it can be done.
If we wanted to get a little more heavy-handed,
yeah.
How about no caffeine in soft drinks? A ban on caffeine. So you do studies on people and you blind them. People drink 50% more caffeinated when the same drink is caffeinated. Mm-hmm. And so it's like, the industry likes to be part of the solution by reformulating. So they take their, cookies crisp and they, now cut sugar by 25%. So instead of, 20 grams of sugar is like 18 grams of sugar. And so instead of being, 30% sugar by weight, it's 25% sugar by weight. But it's just these tweaking around the edges just to, the Cheetos in different countries have different levels of sodium based on kind of, regulatory. It's like that, but you're still eating Cheetos. Whereas there is actually a reformulation agenda that could really help. So menthol from cigarettes and caffeine from soda, I think would really go a long way to helping. And look, the government spends a lot of money on food. For prisons, for the military, for, old folks' homes, for school lunches, on down the list. Well, then, if you want to contract with the government, well, then you have to actually feed them food that isn't going to run up the federal deficit, right? That isn't going to cost us more, right? Isn't going to make us a sicker, weaker country. That just seems reasonable, right? And so, with the SNAP benefits and, all these, there's so much leverage that can be had where no one's taking away anybody's burger. You can still smoke. You can still go bungee jumping, disconnect your smoke alarms, not wear your seatbelts, your body, your choice. But the government shouldn't be subsidizing the sugar industry. Why is taxpayer money making cheap feed crops so you can make dollar menu burgers to just make everybody sick and run up healthcare costs? I mean, we could be, if you want to subsidize anything, how about fruits and vegetables? How about, there's in certain European countries have free fruit programs where on the desk, every school kid's desk is a free piece of fresh fruit every morning. And they crunch the numbers and they're actually the amount that they save in healthcare costs more than pays for all that, for the measly cost of the fruit. But it's just the system, unfortunately, in this country is such that, it's not like, the CEO of Coca-Cola is like rubbing their sticky hand together thinking, I want to contribute to the childhood obesity epidemic. They're like, I need to satisfy my shareholders. At the next quarterly meeting, and how do you do that? Well, you do it with brown sugar water, which is basically all profit. Good food, perishable food, it goes bad. It rots on the shelf. You want a snack cake that sits on the shelf for a few weeks. That's how you make money in the world. These companies don't want to make us sick. They just want to make money. But unfortunately, the Venn diagram of how you make money tends to make people sick. In fact, it's interesting. There was one thing in the presentation today. I actually took out. I didn't have time. There was a new CEO of Pepsi, came in and created a better for you category to kind of offset some of the terrible things they do. And they lost hundreds of millions of dollars, and she's now a former CEO. I mean, it's just like, anyone even tries to do a good thing, they'll just get booted out, right? I mean, it's just how the system works. So that's why we have to take personal responsibility for our own health, for our family's health, for our community's health, where we know what we need to do, and we just can't let these companies who may not have our family's best interests at heart dictate our food decisions.
Excellent. Last question. There are currently in North America, U.S., Mexico, Canada, there's about 1.5 million practicing physicians for all of hundreds of millions of people. So let's, in our mind's eye, let's construct a stadium that holds 1.5 million people and put all the doctors in North America in the stadium.
Nice.
And they asked Dr. Greger to come out to the microphone here. And the agreement was if they came to sit in the stadium, they'd be willing to listen to 3 pieces of advice of suggestion from nice. Dr. Greger and follow that advice. What 3 pieces of advice would you give our medical colleagues who are really listening to you and would follow your advice? What would you tell them? Well,
first of all, we would probably see a decrease in mortality if we got all the doctors and we shoved them in a box. So there's actually studies done on doctor strikes, physician strikes. There was one in Israel. And what happens when all of a sudden doctors don't come to work? Death rates plummet, right? Because they're not being killed by all these operations that are maybe unnecessary.
Shakespeare said, drown all the lawyers,
Right, it was a very similar thing. So, I was doing it's funny. So I'm doing the 10th anniversary How Not to Die in December 2025. And so, and it's interesting, some of there's a little dance of different, diseases jumping. I do the top 15 killers, and they all change a little bit. And so killer number 3 was iatrogenic causes, right? Doctors, right? 106,000 just dead from medication side effects, prescribed as, taken, not illicit drugs, blah, blah, blah. Then there's medical error, and then there's, all on down the list. And so it came to be 3rd. It was like, I forget, 250,000. Okay, but now, the best data we have now is it's probably much higher. So if you add another, 200, so the medical errors numbers we previously had was only in hospitals. But if you add outpatient medical errors that kill people, it actually, you crunch the numbers, it came out to be the number 1 killer. And I said, well, wait a second, that is going to, I think, detract from what I'm trying to say. I mean, it's just, so basically I kept it number 3, but I go through all the numbers and say, well, but, I mean, anyway, this is a bit of a tangent, but, right, look, if you need medical care, sometimes it can be absolutely life-saving, but so much of what we do in medicine may not actually be helping people as much as they think. But we could, with better educated doctors, be able to help people. So if there's just 3 things we were going to inform them on, I think it would be disease reversal. And so that's, I think, what really excites doctors, right? When you talk to people at these lifestyle medicine conferences, and you're like, you're sitting down with them, you're like, how did you get into this? Well, obviously, no, it wasn't medical school. No one taught this in medical training. And so it's like, well, they must have somehow come to it. And too often, you'll hear people say, well, it was a patient. Right? They saw a patient who all of a sudden, patient they know forever, and they're just getting worse, worse, worse. And then all of a sudden they drop all this weight and they feel great, and you have to drop all their meds, and then you're like, what did you do? I've got like 1,000 patients just like you. And they say, oh, I watched Four Silver Knives, or I read a book, or I went to a website, or and so the patient educated the doctor, and like, oh, I gotta look into this, because so that's how they got into it. And then for the first time, you can kind of reignite this idealistic spark we had. We went into medicine. Look, you want to make money, you go to the stock market. You go into medicine because you want to take care of sick people. You want to make people better. But it's hard to make people better in primary care, right? Most of what we see coming in the door are these chronic lifestyle diseases that get worse, 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 and you die. We can slow down the rate at which our diabetics go blind and lose their lower limbs and go on dialysis. But if we actually want them to get better, right? It's just how frustrating. It's like, I will slow down your rate of decline. Like, you look at yourself in the mirror, it just doesn't feel. You want the hands-on, jump out of the wheelchair, But then all of a sudden, when these lifestyle docs start, they're like, all of a sudden they're making people better. And you have smiling patients, and their whole family's getting healthier, and just like, and then, that's why we did this, right? Healthy patients, what a concept, right? And so, to reignite that spark, I would, of course, talk about Ornish's work on reversing heart disease, talk about reversing type 2 diabetes into remission, and probably high blood pressure. That's high blood pressure checks are probably like the most common, thing you see in primary care. And it's, what are we doing? We're tweaking meds instead of really attacking the underlying cause. And if they just knew those three things, how much leverage lifestyle could have, that I think would go a long way, because that's so much of the bulk of what we see of death and disability.
Fair enough. Well, Dr. Michael Greger, thank you for your time and your insights and your animation, and for all you do to spread nutritional sanity out among the public as well as our professional colleagues. So it's just been a delight, and thank you for helping us better insight into healing tomorrow.
Nutritional sanity, let's do it!
All right, all for it.
For someone who doesn't know you, Dr. Greger, what would you say is your X factor and maybe what you're most known for in the world of plant-based nutrition?
So probably, starting nutritionfacts.org, writing How Not to Die, sold 1 million copies. But I think it's, I read every issue of every English language nutrition journal in the world, so you don't have to, kind of thing. It's like, I haven't done clinical practice in a long time, decades. And so I have the luxury to sit in the dusty digital stacks and churn through, which is getting harder and harder these days, just because there's more and more. It's just a deluge now. So I'm writing this new pain book, and there's so many different modalities and stuff. And I saw that they were trying to use Botox for like neuropathic pain or something. Oh, that's interesting. It's just like, I thought I'd do a little sidebar or something, just kind of a curious little thing. If you're in pain, you'll try anything. And so, there are 1,000 papers, like 1,000 papers on Botox for neuropathic pain. She's like, what? Like, I could spend a month and for what, a paragraph in the book? Like, and so it's getting harder and harder.
So the process is, how do you know those 1,000 studies? Some are going to say it works great, some that it's dangerous, and they'll do it, whatever. How do you decide what side you come out on?
So more and more, I have to rely on systematic reviews, which is, unfortunately, I'm relying on these research to actually do it right, and actually pick up things, and have the right exclusion criteria, and so I can say, I don't know if this is good or bad, but I can tell you in the latest systematic review and meta-analysis, this is what they found. Now, did they take industry funding into account? Probably not. Did they? So it's basically, I'm showing my work, right? It's like, this is, I don't know, but here's what the latest review says. And if everybody just knew what, everybody just stuck to the latest meta-analysis on everything, we'd do pretty good. I mean, things would be screwed up, like the egg industry just publishes tons of studies to infect the literature. But on most things, it's like, the tobacco industry with secondhand smoke absolutely just pummeled but you still do a systematic review, and shocker, secondhand smoke isn't good for you. Just because, even though they got no money to do these studies, there's just enough, still, the industry tries, but...
you can't keep a hat pin in a cloth bag for very long.
There we go. Oh, that's a great saying. Right, yeah. So,
point comes out.
So it's not perfect.
Mm-hmm.
And I used to be able to, read every paper on every topic I covered. It's just like, well, so it's like I know as much as anybody in the world on this subject. That makes me feel good. It's like, anything less than that, I'm uncomfortable.